it's called therapeutic rapport, right? So that's how
Hmm.
well we uh, how well we get along with our therapist and how comfortable we feel and how much we trust them to be sharing these very vulnerable things that we're probably going to
Yeah.
discuss, right? So those are the most important factors. You could be a therapist that uses the best, evidence based practices. If you don't have that therapeutic rapport, the client's not going to see a lot of progress.
Right. They're not going
Right?
to respond well to it. Yeah.
No, they won't. And so there is no correct modality. There's certain modalities that probably work better for certain
People.
people
Yep.
and also issues that they're dealing with, right? So if someone's coming in with uh, like trauma and they have specific incidences or kind of a handful of specific incidences, like EMDR works really well for that, right?
Yeah.
Um, with depression and anxiety, cognitive behavioral therapy is usually like the gold standard, right? But I don't, even if that's the best modality, I try to sprinkle that in with also other things because just changing your thoughts is sometimes not enough, right? Behavioral change is also equally important.
Correct. They go hand in hand.
Yeah.
Because as you take the steps forward, it changes. It does change your mind
Oh yeah.
about things,
Oh
like,
yeah.
and change your behaviors. It does change. At least in my case, it definitely helped.
Sure.
Like getting back in the gym and doing those things and like, well, you know my story, and we'll talk about more. We'll talk about that more later. But so for my experience with EMDR, but I was already, and you helped me quite a bit on the path to healing trauma,
Mm-hmm.
and I
Sure.
did a lot of work
Sure.
on my own
Sure.
as well. So when I experienced it, it's just straight to the subconscious,
Oh yeah.
and it's pretty immediate. It took me maybe 2 minutes,
Sure. Sure.
to
Sure.
get there. And my spot on my where I moved my eyes was on the right. Okay.
Okay.
And I guess like it's naturally where your eyes go, where like where you're when you were experiencing the trauma, it's like that memory.
Yeah.
Yeah.
Sure. Sure.
You
Sure.
know what I mean?
Sure. Sure. Oh yeah. Because all that wiring is wired together, right?
Yeah.
Yeah, it's really interesting. And so what they also found too with like it's you could it's just any bilateral stimulation too.
Hmm.
So I'm not did the therapist you saw, did they have like they're called tappers? They're
They
like the
had them, but I
bilateral.
didn't use them.
Yeah,
I used
sure.
the
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 mic. Okay,
headphones.
yeah, headphones.
Yep.
Yeah, so it's just that bilateral
Yeah.
stimulation, right?
Yeah.
And yeah, I went to Chicago to get trained in EMDR, and I
Hmm.
was a little and it was through the a company that I was working for at the time, and I was very skeptical
Hmm.
because I just didn't understand how moving your eyes back and forth were
Yeah.
going to change anything about how you perceive the trauma. And because I was looking at the process that you do in terms of like, hey, what's the worst part of this for you?
Hmm.
What thought do you have now about yourself or the world? This negative thought do you have, right?
Yeah.
And how much do you believe that? Where do you feel it in your body? And then
Yeah.
what do you want to believe about? That in itself sounds like a very just normal therapeutic process, right?
Yeah.
And I thought, what is adding this, you know, eye movement or bilateral stimulation going to even do? And it's just really interesting to see how clients react to it, right?
Yeah.